Good afternoon. Today, I'm going to discuss and give you a better understanding of breast cancer and what the causes, the symptoms, and the treatments are. We all know October is Breast Cancer Awareness Month. And as of last month, when I went for my annual checkup, I had my own scare. The doctor found a mass. So it is very important to go for your annual checkups and after the age of 40 to have a mammogram done. According to Dr. Antoinette Johnson from the Cancer Center of America, breast cancer is a disease most people recognize, and rightfully so. It is the second most common cancer diagnosed in American women, behind skin cancer. That means 1 in 8 U.S. women will develop breast cancer in her lifetime. And that means 30% of women will develop breast cancer. I had my scare just last month when they found a mass that turned out just to be a cyst. And I do have a family history of breast cancer. So I'm going to discuss the symptoms of breast cancer. And in this dialogue, or the diaphragm, it will show you some of the ways and techniques that you can diagnose the symptoms. So many people believe that breast cancer is just linked by finding a lump, but some don't know there are other signs and that can tell you of breast cancer. According to Daniel Liu, in a plastic reconstruction surgeon, says a painless lump in the breast is usually the first sign of breast cancer. Though you may not feel it yourself, instead, many lumps are detected by a routine screening mammogram. In fact, the first diagnosed, most women don't even have an apparent sign of breast cancer. He goes on to say that some common early signs of breast cancer includes skin changes, such as swelling, redness, and other visible difference in one or both of the breast, an increase of size or shape of the breast, changes in appearance of one or both nipples, nipple discharge other than breast milk, and generally pain in or any part of the breast. Lumps or nodes are also found on the inside of the breast. Now I will discuss the causes of breast cancer. As I mentioned before, I did have my scare last month. When my mom told me that we had a family history of breast cancer, which is also becoming hereditary and one of the causes of breast cancer. So according to breast surgeon Judy Bungalow, it is likely that breast cancer is caused by complex interaction of your genetic makeup and your environment. Not just being hereditary can be the only cause of breast cancer, but there are many risk factors, such as being a female, your family or personal history of breast cancer, your age, radiation exposure, or even your weight. And here are some more. Alcohol intake or tobacco, hormone treatment, therapy of menopause, prolonged of oral conceptions, or just another name of more. Finally, I'm going to discuss the treatments that are available for breast cancer. Breast cancer can be treated several different ways depending on how far it's spread and how long you are in your stage. According to the CDC, which is the Center of Disease and Control Prevention, they state surgery, chemotherapy, hormotherapy, biological therapy, and radiation therapy are ways that you can treat breast cancer. However, surgery or therapy may not be your only option, and there are clinical trials and alternative medicines that you could try that will help. To choose what kind of treatment is best for you, you need to discuss this with your doctor. So no matter what, if you show symptoms or you have a family history, please have an annual checkup. Discuss any concerns that you may have with your doctor. And if you're over the age of 40, please go have a mammogram. Today, I went over the symptoms, the causes, and treatments of breast cancer. And having a scare, possibly myself, I wanted to share and give awareness to breast cancer for other women out there. Thank you.